Hi, this is Dr. Arun Mukka, Consultant Endocrinologist at Yashoda Hospital. Let's learn about diabetes reversal. This is something we are able to listen in the recent past, but what is important to know is whether diabetes is really reversible. In scientific terms, it is better to call this term as diabetes remission and not reversal. Reversal means a permanent change. Can the diabetes be reversed permanently? May not always be possible. That is the reason why we call this as diabetes remission, which actually means that if a patient or a subject with a diabetes, if his blood sugars are under good control and the 3 months average, that is the HbA1c, if it is below 6.5 consistently for more than 6 months, and if this can be achieved without any concomitant diseases or any lifestyle or without usages of any medicine, that is when we call a patient to be having diabetes remission. Why is it important? Many of us have the opinion that once a patient develops diabetes, it may not be reversed. It may not be brought to remission. That means he might have to be taking the medicines or insulin for the lifetime. However, this is not so the case, and we need to be aware of this. Diabetes is very well reversible, or something which can be to a broader state of remission. Now, how do we do this? In order to know more about diabetes remission, we need to know what are the types of diabetes and why people develop diabetes. Broadly, diabetes is categorized into two types. Type 1 diabetes, which is a less often seen variety, is because of complete lack of insulin, which happens because of certain disturbances in the immunity. Now, type 1 diabetes is not reversible. Patients from the onset of diagnosis of type 1 diabetes needs to be on insulin for their lifetime. This is one condition, or this is that type of diabetes which cannot be reversed. Whereas the type 2 diabetes, which is what we see in 95% in the OPD, is something which happens because of the lifestyle and genetics. Why? Genetics do contribute to the occurrence of this particular condition, but it is the lifestyle in the current day scenario which is causing this epidemic of diabetes. Now, why people develop diabetes? It is because of a very bad lifestyle which causes excessive weight gain. We call it as obesity. Now, what happens when a patient puts on weight? There is so much of fat deposition in the abdominal compartment, that is around the stomach, especially the vital organs like liver and pancreas. There is so much of fat deposition around these organs. Now, what happens because of the fat depositions around these vital organs? This leads to a phenomena called as insulin resistance, which means the insulin which is produced in the body is not able to execute its functions correctly. Now, by targeting the removal of this fat or bringing down the abdominal obesity or the central obesity and encouraging the patient to lose body weight, we can reverse the diabetes in the early stages. Earlier is the stage of diabetes, more or the higher are the chances of a person having a remission of diabetes. Longer is the duration, lesser will be the chances for the patient to have a diabetes remission. Now, how do we achieve this weight loss and how much weight loss needs to be brought? It is said that if you bring about 7 to 10% of the weight loss at the time of diagnosis of diabetes, if a patient manages to lose about 7 to 10% of the weight, then there is a good possibility of reversal or remission of diabetes. Now, what is more important is how we are able to bring this weight loss. Weight loss, my friends, has to be in a healthy and scientific way. It should not be some kind of crash type of diet which should be causing the weight loss. It should be done in a scientific way under the supervision of a doctor. Now, many of us have an option of losing the weight by various techniques. First and foremost thing, have a healthy lifestyle. Have a regular physical activity of at least 30 minutes of simple walking per day for at least most of the days in a week. As far as the diet is concerned, patients have many options to shift to. They can either go for intermittent fasting, they can go for the keto diet, or they can go for something called as low calorie carbohydrate diet. You can follow whichever of your choice, but it has to be under supervision. Let's not say that one particular diet is suitable for all the diabetic patients. Most of them work in good number of patients, but ultimately the doctor has to decide what is the type of the diet that particular patient should follow to lose weight. And if the patient manages to lose about 7 to 10% of the body weight, yes, what happens then? The fat deposition which has happened around the organs like liver and the pancreas, that comes down. That brings down the phenomena of insulin resistance. That helps the patient to come out of diabetes or to have the remission of diabetes, to bring down the medicines, and sometimes completely the medicines can be stopped in a patient. Now, how long can we manage this state? Now, the reports have described that the patients who have followed the rigorous, regular, healthy lifestyle and the dietary patterns, they could be in this state of diabetic remission for more than 10 years also. So what depends is the motivation of the patient and how regular he is with a healthy lifestyle and the dietary patterns. Through this medium, we wanted to convey that diabetes is indeed reversible or to a certain extent controllable by following a healthy lifestyle. Thank you.